Hello, everyone. It is 2 o'clock, just about on the nose, so we're going to go ahead and get started. My name is Robin Haberman. I am an Associate State Director of Community Engagement for AARP New York, and I'm so pleased to welcome you all to this important virtual session, Building Disaster Resilient Communities. It just so happens that September is National Preparedness Month, so our program is very timely. At AARP, we believe that communities and individuals need to be prepared for disasters and emergencies, which can happen at any time. A key to ensuring that older adults and everyone in the community are properly served by disaster preparedness and emergency planning is better integrated disaster planning that helps local governments protect all residents, whether they're living independently in the community, residing in an assisted living facility, or in a healthcare facility. AARP is so fortunate to collaborate with our presenters today, SBP. SBP is a national social impact organization dedicated to helping communities shrink the time between disaster and recovery by rebuilding homes, increasing preparedness and resilience, and improving systems to better serve the needs of all Americans everywhere. We'll be turning the program over to Helen Wiley and Tessa Barron from SBP in just a few moments, but a little housekeeping first. I just want to let you know we will be allowing time for Q&A along the way, so please be sure to put your questions in the Q&A box. This program is also being recorded, so within the next day or two, you will get a link via email to the recording to play it back or share with a colleague. And please be sure to spread the word about our follow-up webinar, which will take place in 2 weeks on September 24th, which is consumer-focused for community members in New York. So that'll be disaster preparedness at home. Now, we could not have brought you all here together without a little help from our friends. So right now, I just want to take a moment to introduce Alana Kiefer from the New York Academy of Medicine. She is the director of the Center for Healthy Aging and was integral to getting this program off the ground for you all today. So Alana, I'm going to turn it over to you.
Wonderful. Thank you so much, Robin. And welcome everyone. As Robin said, I'm Ilana Kiefer, and I have the pleasure of working at the New York Academy of Medicine. You can see a photo of our beautiful building right here. We are located in East Harlem, in Manhattan, New York City. We have been around as an organization for 177 years, and you can see on the slide that we really work to make bold changes to systems that perpetuate health inequities. We do this through research, programs, and policy. You can go to the next slide. I specifically direct the Center for Healthy Aging, where we, as you can see, work to advance the health and well-being of aging populations, which is, of course, all of us. Every one of us is aging every single day, but we focus our work on the 65 plus population. I will try to speak more loudly through research, policy, and programs. And our goal is that we work to ensure health equity and optimal health, both for today's older adults and for tomorrow's as well. We also do a lot of work at the New York Academy of Medicine on climate change and the intersection of climate change and health, and specifically at the Center for Healthy Aging on the intersection of climate change and aging, which is why we are so happy to be able to support and partner with this program today. I will now turn it over to Helen Wiley for the presentation. Nope, I will not yet. I will first talk about a flyer that we have. We did a lot of work with older adults in New York City we held focus groups and interviews to really better understand, working with them, how they view different ways of ensuring that they can survive and thrive during different types of disasters, often related to climate change and, of course, also pandemics. So we have this 2-page flyer available. It is focused on New York City, but if you are calling in from outside of New York City, a lot of the information is relevant as well. And so I know that we will make this link available. Now I think I will introduce or turn it over to Helen. Yes, there we go.
Thanks so much, Alana. And thank you both Robin at AARP New York and Alana at the New York Academy of Medicine. It's really our pleasure at SBP to be partnering with you both today on this webinar. As was mentioned, SBP is a national disaster resilience and recovery nonprofit. We work nationally across the disaster cycle to improve the system's policies and measures so that communities will ultimately be more resilient, as we'll be discussing today. In terms of our founding and our name, which we often get asked about, we were originally founded down in St. Bernard Parish, Louisiana, after Hurricane Katrina almost 2 decades ago as a rebuilding org. And as the nonprofit scaled nationally and worked across more disaster events, we really saw the need to work all across the disaster cycle and share lessons learned from the different communities and partners that we work with so that other partners and communities would be better placed for future disaster events. And so I lead our disaster preparedness program, which is one of our 5 main programmatic areas at SBP. I do really want to quickly mention that SBP has been doing work in the New York City region in particular since 2012 after Hurricane Sandy. We had a rebuilding operation in the Rockaways for about 8 years, and since then have continued to work with partners like at the New York City Mayor's Office of Climate and Environmental Justice and the Center for New York City Neighborhood on financial resilience tools and other measures. And so it's really a pleasure through partnerships like those and this to continue involving ourselves in different programmatic needs in the New York region. So in our Prepare program at SBP, we work to not only empower households, but businesses and community leaders with essential tools to better prepare for disaster events. Knowledge is really key in the preparedness space in order to take more informed actions ahead of disaster events, as we'll be discussing today. And so across these different stakeholder groups, we have a number of different services that we provide. But one thing I want to note here is that for those of you that work directly with household level audiences, we have a great hub on our website at where you can check out our different household level guides on both preparedness and recovery. Some of them are more quick tips based on issues like building a supply kit on a budget. Some of them tackle harder topics like getting the right flood insurance, homeowners insurance, renters insurance. But we hope that the range of tools we have available will be useful for you and your partners. So today we're really going to get to the core of the matter. And as Alana started to pose up, there's a lot of different things around resilience in this space and what does resilience mean in disasters. And so today we're going to work to contextualize a bit as practitioners of what disaster resilience means. And then we're going to put resilience more in context across the disaster cycle with different case studies across the country of the types of activities that you or partners could consider getting going in your regions of New York so that you can better help older adults and other vulnerable populations. We'll include in this some examples of the type of work that SBP does across the cycle. Importantly is that this is definitely non-exhaustive to all the different types of programs, policy measures, and mechanisms that are really needed to build greater resilience in communities. But we hope that the different examples we share will help expand your knowledge base of things that you might want to consider or learn from for your own communities. And so we're going to try to have this be a little interactive. And so I'd like folks to, one word, several words, put the top things you think of, what are characteristics you associate with a more disaster resilient community in the chat box. And so I'm going to wait a few moments while folks start dropping stuff. I see someone just dropped the word informed, connected. I see another connected, strong relationships, more inclusive and accessible, neighbors that know one another. I think that's a great point in terms, again, how do we better support and prepare one another? Age, that's good, an age inclusive emergency preparedness response. Another, again, more connecting back to being connected, interconnected, communication. There's so many good ones here. This is great. We've got another one really quickly, resource, knowledge, policy, making sure that there's appropriate government level response, making sure that there's things that are addressed at multi-generational challenges. And I see here as well, Alana just dropped, just so it doesn't get lost for anyone, the flyer that goes to the 2023 resource that NIAM put out last year on COVID-related issues and disaster resilience. Okay, thank you everyone for participating there. So I just putting up this graphic briefly because it just highlights a few of the different buckets that you all very nicely started to identify in your quick comments of what you quickly think about. And, when we think about community level disaster resilience, it really is critical that we're working on a bunch of different components of resiliency. And so things that have already been mentioned around more effective communication, understanding our risks, knowing level of risks in different scenarios and conditions depending on the type of disaster you're facing. Social connectedness, that was hugely identified and by folks in their comments in the chat. And having collaboration between stakeholders. And so importantly here is knowing that, in any type of framework or definition around disaster resilience, that there's a lot of complex intertwined pieces in building more cohesive community level resilience. We're not going to go into great depth today, but I really want to call out that excitingly, FEMA, the National Federal Emergency Management Agency, just released guidance a week or two ago in August. That is now the new National Resilience Guidance. So it's a new report they released. I have the link here. And what they importantly call out in this report, which we'll very much go into here today, is that, resilience can be defined and approached in many ways. It's used in so many disciplines now. You've got different public health resilience related definitions. You've got disaster, you've got climate resilience, you've got all these different ways and contexts that we think about it, ecological resilience. And so in the disaster space specifically, especially now with FEMA having released federal guidance, it's really helpful for all of us as practitioners to utilize this new resource that's come out. It's about 40 pages in our own practice. And so I want to say that specifically the way that they are defining resilience is the ability to prepare for threats and hazards, adapt to changing conditions, and withstand and recover rapidly from adverse conditions and disruptions. And so there's a lot to unpack there in that definition, but importantly, what it lays out is that there's preemptive actions that we need to take, knowing what risks are, and that we need to be changeable, able to move with what comes and faces us and have that inform how we're recovering. And so while that was just laid out, I'm going to go with a definition today, just for the purposes of this presentation, that we've been working with the last few years that corresponds with a lot of how different state emergency management departments or offices of resilience have laid it out. And that this simplifies it a little bit of households and so disaster resilience refers to households and communities that are able to anticipate, prepare, absorb, recover, and thrive ultimately when presented with environmental change and natural hazards. And so we're going to utilize this definition today because it goes very smoothly through the disaster cycle. So once we get to some of the case studies, we'll be placing them within the anticipatory phase of disaster, preparedness phase, and then the absorption or shock phase, and then long-term recovery. But importantly, these definitions are very similar and have a lot of crossover features. For those that are newer to thinking about disaster resilience framings, say that you work with older adults, but in a very different context and don't think about emergency preparedness and disasters day to day. What's important when you think about what does it mean to build more disaster resilient communities is that any activity, and building towards greater resilience, it's just going to be one layer in that larger puzzle. And so one analogy that's often used is the Swiss cheese analogy, that there's holes in each layer, but the more layers of activities we build up, those fill in layers in the previous or holes in the previous layer. And so that's one way that we think about disaster resilience building activities at SBP. Another good visual again here is that, disasters are shocks to a system. And so the goal really in different activities that you and community members and other organizations you work with can be building is working towards that ultimately community members will recover more quickly if and when a disaster is experienced in the community. And so higher resilient communities don't feel impacts as deeply and are able to recover more quickly. This is very much gone through in detail in the new national resilience guidance that FEMA released, but there's a lot of good documentation and research literature and by practitioners over many decades that ultimately resilience and resilience building activities are going to look different in every community. And so it's important to recognize that what might work in certain boroughs and neighborhoods within New York City could look very different than a rural part of upstate New York. Knowing that the right measures need to adhere to, what are the population demographics? So if we're, working on measures that could work for older adults versus youth populations, utilizing more written guidance, in-person work versus very tech-focused solutions and messaging is important to consider. And then, what are the measures that work for the geography and built environment, for instance, in an area where you're working on a preparedness campaign? What are the abilities in terms of helping to inform mitigation measures at the household level? Are housing units all attached or are they separate? And so really considering that while there's also great things that you can learn from other communities, some of those things may not work in your area because the community looks very different. I pulled this actually from NIAM's report that Alana referenced that came out last year on, resilience to COVID-19. And it's a very complicated chart, so I'm not going to spend too much time on it. But this is my last kind of hammering home on how we're framing up disaster resilience, is that here you can see that building community resilience is ultimately an ongoing activity. You can see that in the circle to the far right. But there's all these feedback mechanisms here in how we're seeking to build education, more participatory processes and engagement with key stakeholders, and the right partnerships for that informing, what is effective risk communication look like for the right population and that creating that right social connectedness. And so really considering that no matter what piece of the larger puzzle or which slice of Swiss cheese that you're working in, that you want to place it within this larger map of what are ongoing community resilience level activities that are needed in your area. So that was a lot of contextualization. We're going to now go in more depth here on each of the phases of disaster. And so as a reminder, here we're going to, work through from anticipatory action phases in disaster to the recovery phases. And so starting out with anticipating disasters, what we really firmly believe at SBP is any decision making around programs, activities, grants you might want to put in to support populations, it's really important to do good data assessment in the community or for the population that you're working with. Again, there's so many differences depending on what data sources you use and which vulnerability measures that you're seeking to focus in on how that informs then how limited dollars and resources should be spent. So I'm going to call out here, there's so many wonderful risk analysis tools in the US, but I'm going to call out a few different ones that we point people to at the national level, and then I'll point to a few ones that are specific to New York State and New York City. One great resource is the SOVI Index, which is the Social Vulnerability Index, and it's supported by the University of South Carolina. A lot of their indice measures have been incorporated by FEMA and other federal agencies into how they think about risk analysis. But it's a really great comparative tool that helps measure the vulnerability of U.S. counties to natural hazards events. So any of you guys that work more statewide in New York, you can utilize this index to help you better understand where to prioritize limited resource across different counties that have vulnerabilities. Another good tool that I want to call out for those of you that come from more public health disciplines is that the Center for Disease Control and Prevention, the CDC, also has the Social Vulnerability Index. And it's also a great place to, again, better understand some of the differences across different communities. It's a little bit less focused on disaster specific, whereas the SOVI index from South Carolina is very natural disaster focused in many ways. FEMA and federal agencies, I believe now it's hard to keep track. A couple years ago now, they put out the National Risk Index, which also has a lot of different variables that you can manipulate depending on what hazard type you want to look at, what population, what income levels, so you can better understand in your census tracts some of the issues that could be impacting folks. There's also a lot of private sector tools that have come available. So for, again, is trying to understand climate risks and disaster risks in different communities. Risk Factor, which is put out by the First Street Foundation, is another good tool to consider utilizing. It gives at the household level, so you can put in either a specific address or zip code, a score between 1 and 10 for different hazard types of flood, fire, heat, to tell you yes, I do see that comment, Sonia. And so this is one challenge there with Risk Factor is you can still see your score between 1 and 10, but to get additional, more granular level information now, you would have to sign up for a trial and fee. And so that is the challenge now with some of the private sector tools, but you can still get some great precursor information or direct community members to it as a place to start learning more about their individual household level risks. And then for those of you in New York City is, one of the places in the country that has really great city level data on risks. And so for anyone not aware, Flood Help NY is a fantastic resource that the New York City government has in conjunction with the Center of New York City Neighborhoods and other partners, where you can learn more about your risks at the individual property level in the city. That website also has a lot of other great resources. And so I just spent a bunch of time here going through different, data resources, but I just want to emphasize again how important we believe it is to learn more about what are different data sources out there that you can utilize, because any type of preparedness plan, whether it's at the community level or household level, really starts with better understanding the risks for the intended population you're working with. Okay, so we're going to dive in a little bit more depth here. So we're in the anticipatory phase of the disaster, and you're considering different activities that are important. And when we're in the anticipatory phase, what's really important is moving from not just learning the risks, but into putting together the right planning measures for any local initiative you're having. And it's really important, of course, when we're thinking about planning, that any measures that we're creating are intended to help lessen the impact of a disaster event. One of the most direct things to think about, of course, particularly when we're thinking about older adults, are, measures that can help decrease the number of deaths. In 2022, for instance, there were close to 500 people that died directly or indirectly, according to NOAA data, from extreme weather events. What I'd say is not very well captured in that is deaths from extreme heat events, which we're increasingly seeing as an issue across the US, and those in particular affect older adults. But identifying in the anticipatory phase, what are the things, if your organization is working more in that phase, we'll get to recovery phases of things that you can do to help folks. Importantly, of course, disasters are also very costly. And so In the planning stage, it can also be hard often for organizations to help justify, the cost of putting together a preparedness plan, putting together a mitigation plan. But what we know ultimately is that the costs of disasters are so many times worse. It depends on what estimate measure you use of what the different calculation is, than the time and money that can be invested in better planning and mitigation efforts. And so really important to take planning measures because ultimately it'll save money long term. And of course, speed recovery. And so for you and your organizations, it's important, in this phase to be thinking about what are the impacts that are most important to address for you and your organization? Where do you invest? What projects can do the best job of lowering risk and would be good investments for you? And who's going to do the work? Are some of the things that you're identifying as greatest need things that, while very important, are not things that can be best executed by your organization, and therefore you need to identify the right project partners to conduct those? And are there things, for instance, of, who needs to be better trained in delivering information? So if you want to work on a local preparedness campaign, are there key intermediaries, folks that directly work with an at-risk population that you need to work with to better train and inform so they can be that trusted intermediary that brings information to household members? Another resource we just want to point out in this phase is that FEMA has the community lifelines, and these are to support response planning and operations. And the concept can really be applied throughout the entire preparedness cycle for disasters, because the FEMA lifelines are backbones that support like all other aspects of a community and are really intended to help protect and stabilize folks during incident response. And so you can see here the different categories of how FEMA thinks about these fundamental community services that need to be provided. And so for you and your orgs, when you're trying to think about where to prioritize, you're well already placed more in one of these lifeline areas. But FEMA has really good guidance that corresponds with them on things to consider in terms of key activities then in each of these buckets. Really quickly, for instance, because we're thinking a lot about older adults here, is that under health and medical, for instance, this covers all aspects of medical services required during emergency, including survivor care, facility management, public health, and the medical supply chain. So for instance, if you work, for instance, with a facility that houses older adults with needs, ensuring that emergency evacuation plans, different generator systems, like additional measures are put in place based on learnings of what did and not go well last time are done so that folks are better prepared and equipped with access to medical services if and when a major event occurs. And just a reminder, we're going to be pausing soon, so please put any questions as we go along in the chat, because we're going to take a break soon for some questions. And so I have the link here on the screen for where you can go to learn more about FEMA's Community Lifelines guidance. But it's really helpful, and it actually will take folks that want to utilize it through different phases of mapping out for you and partners of your different stabilization targets during like pre-incident. That's more emergency management language. But what are those key response functions that are needed and that could be provided by you, and then stabilization measures. I want to take a pause here and then have another quick engagement activity. So if folks can reflect on, for those that you serve and work with in your communities, what are some of their biggest barriers to building resilience? And again, this could be one word or several word answers. Just take a quick pause while folks put some ideas in the chat. So while people are thinking, this could be, for instance, that's a good one. Someone put that they are very rural. So again, issues there with getting access and creating the right communication methods for folks if it's hard to reach them. Another one is reliance on power, electricity for medical devices, food, and communication. So how to deal with when there's power outages and then still making sure that folks can keep things at the right temperature or run devices. Someone wrote that there's very powerful real estate interests. So I assume that has to do with it can make it harder to also take some of the right mitigation measures. Challenges with no flood insurance. I specialize in flood insurance affordability issues in particular, so that one speaks very well to me. We have financial barriers, that a community is very poor. Willingness to understand that there are disasters, I can take care of myself attitude. This is something that we see a lot, particularly in regions of the country that have experienced a lot of disasters, that there can also be sometimes an arrogance that we know what to do. And so informing people that risk levels have changed can be really challenging. Competing priorities with seemingly more immediate needs, huge issue. This is one of our biggest challenges, and then working in a preparedness program is creating the urgency is really hard with all the very pressing challenges folks face. I'm just going to do one or two more here. Only one small medical facility in our county. It's difficult to get volunteer fire and EMS personnel due to the rural situation. Many work during the day, so there's little to no response, and paid crews come from a distance, so response can take a long time. And then I'm going to end here with fear and trust in helpers. Going back to the previous comment, so, with that being a challenge that there's very limited resourcing with only one small medical facility and that there's big distances for folks. So, there it's obviously hard overnight to plan for how to build capacity in an area, but are there scenario-based exercises that those that work in emergency response can work on together to identify some of the biggest key gaps that need to be filled first and create any type of kind of stopover locations where folks can deploy from, or some resources can be pre-positioned. This isn't a great example, but for that particular challenge, but one thing I've seen, for instance, in rural parts of South Carolina and North Carolina that have faced a lot of hurricane-related issues in recent years is that the long-term recovery groups and volunteer networks in those areas, knowing that it's really hard to quickly deploy resources after major flood events, have now gone through and purchased tarps in bulk, and then put them in really key locations that more volunteers are likely to get to quickly to then distribute out and get tarping on roofs quickly if roofs get wiped out by an event. And so thinking in that type of way with your partners of ways to deploy resources to key locations in rural areas is a great part of kind of anticipating and planning for disasters, but it's really hard. Okay, so, we talked more about anticipating disasters, understanding data, starting to plan for what gaps you're seeking to fill. And so now we're going to talk a little bit about, what are activities that we can work to build in better preparing for disasters. And so I do want to call out specifically AARP's Disaster Resilience Toolkit. We share this no matter whether we're doing a presentation with AARP or not. It really is a good resource for better understanding as a practitioner the needs of older adults, and acts as a really good resource. Yeah, thanks, Robin, for linking that in the chat. So, one thing we want to highlight here as a great case study of what folks can be doing, and this is highlighted in that guide, is that disaster registries are really important for first responders to know who to help first. And so when we think about older adults and those with disabilities who are not able-bodied, it's really important to work to get as many folks as possible registered locally so that they can get help quickly when an event occurs. The goal in response and recovery of emergency managers is to help those that are most at need. And so the more we can do to help them know who needs help is really going to speed up their operations. So a case study here, for instance, that's highlighted in that report is that in over like 2 decades ago in Southern Oregon, the regional government developed a registry for older adults, those with disabilities and caregivers. And so because that had been developed in the last few decades, with people continuing to update themselves in the registry and first responders do outreach to also make sure that occurs. Then when in 2020 there were bad wildfires, people quickly received calls offering support and assistance. So having that automatic, not only, them going door to door, but like knowing to outreach to those folks and find out if there's anything that they need or if they're stuck at home. Here's where we're going to go back and forth between some external examples and SBP examples. So at SBP, in our work across many disasters in the US, we see so critically that it's important to build greater, what we'd call financial preparedness for disaster events, because access to insurance is so hard. Navigating FEMA's disaster assistance awards, disaster aid is very challenging. Accessing loans is challenging. And so one area that we really focus on in our curriculum to stakeholders, and so for any of you that end up joining our webinar in a couple of weeks on household level preparedness, something you'll definitely see us emphasize is that in building a culture of preparedness, we're at all levels, from household up to government level stakeholders, we need to make sure that financial preparedness is part of how we're planning for events. And so there are 5 key action areas that we advocate for household level preparedness at SBP. And so that's knowing the risks, making a recovery plan in advance, purchasing flood insurance, getting your important documents secured. So for those that are less tech savvy, that could mean having help of a younger family member to scan your documents or make copies of them and put them in a waterproof folder. And then taking important mitigation measures to reduce risks to property. So for anyone that joins us in 2 weeks, we'll go in more in depth on some of the easier actions and starting points, as well as some of the harder measures. But at SBP, again, one of the pieces of the larger preparedness puzzle that we take on is really working to increase folks' knowledge base around key issue areas like how to increase access to flood insurance. And so as part of this, again, we'll go in more in depth in a couple of weeks, but we want folks to understand that making your preparedness plan is so much more than having a disaster supply kit and making an emergency plan. It really requires planning in advance how you'd recover should an event occurs. And so going through and making that, plan of what are the different financial tools you might be able to access should a major event occur. And this is just really smart to do regardless of if we're thinking about a natural disaster like we work on at SBP, or something like the pandemic, where folks not being able to go to work for a long time really created financial stresses for a lot of folks. And so again, we'll go in more depth in a couple of weeks, but in this area of SBP, we really work on helping folks to better understand how to re-budget and where disaster planning fits in their overall financial planning. And we have a lot of different tools and resources on our website for this area. So I'm going to pause now. There's so many more examples, of course, in preparedness across again, communities of what types of activities folks can be doing. But I'm going to pause really quickly. If anyone has any questions, please feel free to put them in the Q&A. I see that there's a few kind of technical questions. But then meanwhile, I'd like folks in the chat to put in some examples of how your orgs do work in the anticipatory or preparedness phase of examples. So, one sentence or a couple words here of the type of activities that you may be involved in.
Helen, there aren't any open questions in the Q&A box right now.
That is fine. I just checked that as well. Thanks. I'm going to share an example of something that someone put in already. One thing we do in our rural community is that we use HyperReach, which is a database that people can sign up for. They can get immediate alerts. Our county emergency service department can send it to just one street or a town or the entire county, but it is supposed to be a great resource for us to get information out there. Some of our current focus is getting people to sign up for it. So that's a great example. So again, for folks that, maybe that's what you've targeted in your community as being important, of like what type of registry base would be helpful to really segment more who needs alerts and what scenarios. Maybe look up HyperReach or other tools similar that other communities have deployed. Another example someone put is we send email alerts for pending weather, etc., reminding home care providers about tips to help their patients and staff. That's a really great idea, because I think what we really face with different population bases we work with is that, again, it can be very burdensome to need to do a lot of education outreach directly to the vulnerable population, so in this case, patients. But if you can increase the knowledge and capacity of their care providers or, the nonprofits that work with them, that can be a really great way to get more information out that then can be appropriately shared when possible to the directly intended population. Another example, our nonprofit has developed a disaster preparedness training that covers mucking and gutting, compassionate care. This is geared to the faith community, as they tend to be the first boots on the ground. That's really a great example of important work in this space. So identifying that, getting out volunteers very quickly, particularly from faith-based communities, to be able to do mucking and gutting requires those potential volunteers to actually be trained first in best practices around mucking and gutting. And so filling in that really key space there, that again, just one layer in building more resilient communities, but really critical to be identifying these and having folks on the ground providing these services. And then I'll just do one more example here unless one more shows up. But when admitting home care patients, we make sure they have an emergency location in case they need to evacuate. That's a really good example again. So taking that future preparedness contingency measure so that you know where to send folks if needed in the event of emergency. Okay, thank you everyone who shared some examples. And again, any other questions that come up, please feel free to put them in the Q&A. So we're going to talk about absorbing disaster shocks now. So this is when a disaster occurs, what are the types of activities in building more resilience that folks can be doing in their communities? And so one example of kind of how to think about absorption activities is, safe rooms. So we have traditional states in the US where a lot of tornadoes occur. I believe New York is, as well as many East Coast states, have been having more tornadoes in recent years. But here's a good example. So Joplin, Missouri had a really deadly tornado back in 2011. SVP actually worked on rebuilding homes there after that event. But in response to going through that really devastating event, the school district there identified the need to build safe rooms in each of the different school buildings throughout the community. And so they built 14 safe rooms to shelter not only students, but serve as like a wider community shelter should there be future tornado events. They really took, important measures there. So ensuring that they were built in the right weather, right mechanism so they could really withstand like high wind events. And so this is based, unfortunately, on experience, but clearly I did identified gap based on the data as well for future risks. And so important action that was taken. And so good example of, for folks in areas that are trying to get more systems in place, absorption measures like having safe rooms in homes, facilities, schools is a really important starting step. Another example in absorption, and this is something that's been really exciting happening across the US in recent years, is that resilience hubs are being created in both urban and rural communities to serve as these supports for residents to increase overall community capacity and therefore also promote community cohesion. They can take a few different forms depending on what communities have identified as biggest needs, but some of them serve more as like physical resource and service distribution centers. So more at the time of a major event, if there's, for instance, an extreme heat event or major power outage, these facilities will have generators typically and ensure that AC and cooling can still be provided to at-risk residents. And so folks then can be directed to go to them in those times to, again, not be put at risk of different heat-related illness. Same could be true during extreme cold events when, again, folks are guided towards these if they don't have good access to reliable heat. They can also be, though, more than that, just physical place to go if you need help after an event, but be an area of, pre-disaster planning. And so a place where, again, if they're housed out of a community center that has had now these investments of generators and solar panels, any kind of additional resiliency measures, they can be this place, though, for larger educational initiatives. So a number of communities around the country have embedded resilience hubs in libraries. And so making libraries a house for, larger educational initiatives on preparedness and bringing stakeholders together that work with older adults and other vulnerable populations to do more communication and planning and creating those connective tissues during non-disaster periods. So one quick example, for instance, is Orlando transformed a number of their community centers throughout the region into resilience hubs. They took much more the approach of like that physical location that people can go to access things like Wi-Fi, apply for benefits, get help in applying for disaster aid. But they can also then during non-disaster periods act as that place to distribute other types of resources that community members might need. Another more local example I'd like to give of things that are important as we think about absorbing shocks is that New York City, for instance, has been undergoing an exciting initiative for the last year or so, where in response to the increased risks of rainfall-based flooding that we've been seeing in New York and around the country, and with the remnants of Hurricane Ida coming through a couple years ago, New York has launched a Rainproof New York initiative. And I actually had the pleasure to be part of one of the working groups that was convened to help the city identify potential solution measures across one of the three identified important areas. And so in an initiative like this, and I'd encourage folks to check it out if they haven't learned about Rainproof New York yet, but working groups this first half of this year worked to identify priority area measures that could help in the three areas. So one is managing the increased risk of rainfall. And so that working group really identified measures that could help in terms of greater investment in infrastructure across the city. There was a housing mobility focused group that focused more on how to create a floodplain buyout program for areas of the city at risk that would work better long term. And then the group I was in was focused more on everyone has a role to play. And so how to build the capacity of public and private stakeholders across the city to message around the increased risk of rainfall-based flooding. And so efforts like this, New York has more capacity as a big city than many places, but offer a great example of a risk and need was identified in the city that rainfall-based flooding is something that we really need to work on addressing. And so they created a multi-stakeholder task force and working groups to help inform priority areas that the city now can start with its partners to prioritize what they're going to tackle first in the next few years as they also work to put in different grants to fund this work. And so, you can have things like this at all different scales, but this is an example of something that New York City has been very involved in. And you can learn more about that effort by going to Rebuild by Design's website. And then an example I want to give here of work that we do at SBP when we think about, absorbing shocks to disasters. With our origin being in the rebuild space, what very quickly became important at SBP in working to rebuild homes for low-income survivors and communities we work with across the US was that it's really imperative to help homeowners build to higher resilience standards with the increasing frequency and intensity of disasters we're seeing across the US. And so we work in, as funding allows and the structure itself allows, to put in as many resiliency measures as we can into our home rebuilds. And so one of the things that we really try to do is in hurricane prone areas is put on fortified roofs. Fortified roofs are a standard that was created by the Institute for Business and Home Safety, which focuses on insurance issues largely, and is a standard that is able to, standard of roof construction that's able to withstand extremely high wind events. And it often results in insurance discounts for those that are homeowners. And so we try to do that for our low-income survivors in coastal communities so that knowing that they're still in a high-risk area, their structure will be able to much better withstand a future event. We also try to invest in lower cost measures, but that position households better for future events as well. So again, if an area is very flood prone and a house isn't able to be raised, we, for instance, try to put in vinyl plank flooring into homes because we know that it's much easier to clean quickly after a disaster event, and you won't have to replace the whole thing each time. And so taking measures like that so that costs can also be reduced for folks should they undergo another flood event. Okay, so we're going to share a few examples here of recovering from a disaster. And so again, as you guys shared so many great examples already in the anticipatory and planning phases of disaster, there's so many examples of activities in each phase of a disaster that can help communities to be more disaster resilient. An example I want to share in the recovery phase of disasters is Harvey Home Connect. It's an online home repair system. And so this was a system that was created in the Houston area following Hurricane Harvey, where it was really hard at the time to quickly match households with trusted nonprofits and partners that could provide home repair services. And so this online system that was created really worked as this way to quickly enable households to put in applications for help and then match them with nonprofits that were reputable and working in those areas of the region where they were located. And so creating this matching system ultimately helped in a region that is very spread out be able to get services out much more quickly to households, which is again the goal here is we want to shrink the time for folks and speed up recovery. And so that's a great example of something that nonprofit partners put into play in a region based on an identified need for this phase of the disaster. An example of something that we do at SBP is, again, we work heavily in the rebuilding space as an organization. And we know that for low-income homeowners across the US, if you need to rely on dollars through the Housing and Urban Development, HUD, at the federal level, that those funds can often take 3 to 5 years to come into your community before you would be able to rebuild your home. And so we have created a funding mechanism in a few different regions. It's been operationalized so far in Louisiana and Florida, where we work with a private sector loan company to be able to provide short-term loans to fund immediate construction for qualified survivors. So those that working with state government, we know will qualify for HUD-funded recovery funding when that does eventually come in. And so in this way, we can work for low-income households to ensure that they get a loan to start rebuilding much more quickly than they would if they had to wait 3 to 5 years. And then later, the loan will be reimbursed to the private loan company through HUD when the money comes in. And so this is an example of, for a nonprofit like us that works very heavily in this space of trying to increase access to financial tools that can speed up recovery, something that we identified being a need. But it's, it's a really hard thing to get working in more states and regions of the US. And so again, nonprofits and partners have to think about what are the biggest needs they can serve and what is also feasible depending on their capacities and expertises of their organizations. This is just a quick example of one of the first residents that was helped through this Recovery Acceleration Fund mechanism that we created. She was based in Kenner, Louisiana. And ultimately, without having this funding mechanism that we helped put in place for her, she would not have been able to get home when she could have. And Miss Elsie Lewis is herself an older adult. And that's certainly true for a lot of the low-income homeowners that we serve at SBP. Okay, and so we're starting to wrap up here. But for those of you that work, more in the absorption and recovery phases of disasters, or, that's where you would end up being operationalized based on where you work if an event occurs. Please feel free again in the chat to share any examples of how your org works to help community members absorb or recover from disasters. Oh, and that's great to hear from someone that they're in Houston and they're using Harvey Home Connect, the example I shared with Hurricane Beryl, which happened earlier this summer to help folks recover. And then I'm going to check the chat box. Okay, I don't see that there's any open question there, but again, please feel free to be thinking about questions to put in the Q&A. I see an example of they work heavily with crisis cleanup to find those in need and deploy congregations to assist. So that's a great example of, again, identifying partners that can help go out to folks if and when an event occurs. And so utilizing faith-based partners and communities to go out and serve as volunteers.
We have a couple of other questions that I have received directly. So I think some people are wondering if you're just starting out in this, if this is your first foray into disaster planning in your community, what are the best starting points?
That's a tough question. So first and foremost, it depends what type of organization you are. And so let's say, okay, as an example, you're a social service organization that you work with folks on housing affordability more broadly. Okay, so you've identified that disasters are a major challenge for folks that are just on the cusp of being able to afford a home, but having a major disaster, they would not be able to absorb the costs of that, and that would really, not enable them to keep paying their mortgage payments. Okay, so that's a very particular example, but that's, I think, where you have to face here is it really depends on what type of organization you are, of what your starting point might be. So I think with an example like that, again, it's really important still to learn about the risks yourself. So that might, again, using one of these tools I shared, it can help prioritize for you in a community of like, what are some of the areas that have the lowest incomes in proportion to housing prices. If you're thinking more about renter population, so a different type of org, that renters are disproportionately impacted by disaster events, which is true for all of the US. Again, utilizing different risk tools at your disposal to identify some of the neighborhoods and communities that have folks disproportionately at risk. That's always the starting point. So knowing like what population you want to target with any type of effort and initiative. And I think from there, really, again, depending on how you work, what type of org you are, there's always more education efforts that could be done for folks. As someone had put in the chat, with so many issues being top of mind day to day, disaster preparedness is really hard for community members. And so finding those educational like opportunities through, maybe people will come in the room if it's learning more about like something related to their medications and how to make sure that they can keep going with the prescriptions. Maybe there's an opportunity to add in your org like a fact around making sure that your list of medications is updated online in your provider system so that if a disaster occurs, like, and you lose any physical evidence you have, so any written out lists of what your current medications are, there is an up-to-date record somewhere that you could go to find out what your current medications are. Things like that is, creating bite-sized information for households and embedding it into other forums and places that people can learn about ways to start on their preparedness journeys is important. But I don't think I answered the question specifically. It just really depends on what type of org and place people work.
No, that's actually really helpful, but I do see another question in the chat that I'm also interested in. Somebody, I think from Minnesota, said they're working on integrating emergency planning into the state's multi-sector plan on aging. New York, as many people on this call probably know, is also working on their master plan for aging. So do you have any thoughts, recommendations on including community level planning, where did it go, into a statewide planning document?
Well, first off, that's really exciting that both states are working on their multi-sector plans on aging. And so again, disasters are shocks to our existing systems. And so I think what's important in those plans is when we're looking at infrastructure gaps, what are the things that would and wouldn't work in an emergency? Are there bridges that would be downed if there were a major earthquake? New York did recently have an earthquake, so I know there is some earthquake risk. I think less so in Minnesota. But, identifying across the major sectors, like what are the things that would be further exacerbated in a disaster? And so I think that's one level of thinking about it is you could obviously have a section that's more disaster specific in terms of planning for older adults or integrated across different sectoral issues of additional considerations during disaster events for each of those to strengthen systems.
Great. And I think one of the things we consistently find is sometimes with something like disaster planning or any number of issues, there are a lot of resources available, but it's hard to find them all in one place. So if somebody wanted to kind of compile those resources for their community, where would they start? What would they look for? Where do you go to kind of just begin that resource
Yeah, that's a great
profile?
question. So, I will say that a lot of like state or emergency management departments or city, offices of sustainability are a great starting point to go to know some of the state or city level resources out there. They've often done a lot of that aggregation. If you're in a more rural area, going and looking at if there's a like local council of governments or like multi-jurisdictional planning agency, looking at so many of the documents and resources they might have uploaded. So I think those are good places to start on kind of, pulling some of the more government level resources out there of like what are hazard mitigation plans that have been created locally because they're required in order to access federal funding in most cases for government level entities locally. And so they'll have one even if it's quite old. And so, looking in that, for instance, if you're also trying to identify more needs locally of things in a hazard mitigation plan that might have been previously identified as some gaps or needs for planning in the region. And so are there things that were already pre-identified that you as a nonprofit, for instance, could look to that for some of your own gaps analysis of areas that you could look to fill in future grant and programmatic efforts. But I would also say when thinking about, again, starting to pull together that resource bank, of course, there's a lot of great things from government entities, as I just mentioned, but are there key social network providers in your area that while they don't work in the disaster space specifically, they are the more like social services focused NGOs in your area. And so knowing what programs and initiatives they have that you might want to still kind of pull into a master list because they might be the ones that folks would turn to in the time of disaster to help provide different services. So bringing that kind of into that mapping that you're doing. The other thing I'd mention, and it was actually just put in the chat, is that every state has a VOAD, so Voluntary Organizations Active in Disasters. And so they also have a lot of good like resources that you can pull in locally into things to turn to. And so it depends on the state of how much is on their website specifically as VOAD networks, but they typically have very active like monthly calls and newsletters that go out with different state and local resources across the public and like nonprofit sectors. And so it can be a good resource as well as you're seeking to kind of pull in different things you should maybe turn to locally as resources.
And from a local advocacy standpoint, if somebody was looking around their community and saying we don't have enough or we're not prepared, and you want to take this to the town or the city or the county, what kinds of questions should you be asking? What kinds of starting actions might you want to take in approaching this with your own community at the legislative level?
Yeah, that's a good question as well. So I think, again, it depends on what issue you're trying to tackle. If you're trying to just make disaster preparedness a larger, like legislative and funding priority locally, um, I think it's important to band together across different organizations. So again, build that coalition of local partners and maybe perhaps bring in local business interests as well, so that it's clearly identified that it's not just nonprofit and social service oriented providers, but also businesses, small and large, that are looking for, greater action taking in the preparedness space or disaster space. Chambers of commerce specifically can be a really powerful local partner to work with, particularly in more rural areas, given that they have a lot of weight in helping to build different local initiatives. I think that it's also important, there's so much money, particularly coming in from the federal government level right now for future resilience-oriented projects across the US. And so if local government and decision makers are still skeptical about the importance and viability of moving forward with greater disaster resilience initiatives, it becomes very easy to turn to some of the state and federal databases to look at like what types of projects have been funded recently in the resilience space. And so I think pointing to examples from nearby communities, similar types of communities, and so that local leadership can better understand that like our similar types of communities, towns nearby are taking steps forward. And so we need to be doing this as well to keep up, but also most importantly, better prepare vulnerable populations locally. And I think, again, the data is important. The National, is it National Chamber of Commerce? I'm blanking on their name right now. Apologies for that. But there was a good report that just came out this summer that also further documents the costs economically of not taking action in the US. And so I think always bring to stakeholders the most up-to-date knowledge and facts that we have through science and research on what are the costs of inaction. And so I think that's important for decision makers locally to have when they're weighing whether to put more funding towards future preparedness efforts in particular.
That's a really great point. And I'm not sure if this is a question for you or Tessa, but I did want to plug again that in 2 weeks we have on September 24th, we're hosting Disaster Preparedness at Home. And I really hope you will all share that information with your networks. But can one of you give us a little preview of what to expect and just kind of the high level of what's going to be covered so we can kind of share it out far and wide and make sure all of our residents at home are prepared for any emergencies?
Yeah, I have just a couple more slides here. So I'll get to plugging what we have in 2 weeks in a little bit more depth here, but we're really at the end. And so I'm going to largely wrap up. What I just want to say here is we just covered like the 4 phases of the disaster. And I'm sorry, just looking at the chat. We just covered the 4 phases of disaster. And in the definition we given, in building resilient communities, we're ultimately trying to work towards building thriving communities. And that's a very hard thing, obviously, given, as we've discussed, that there's a lot of very pressing day-to-day challenges and many layers of activities we need to be building in our communities. I'm going to share one example of something that we're working on at SVP, and this is that there so many low capacity, more rural communities in the US that have a lot less access to resources and ability to put in grants to the government, federal government in particular, for a lot of the infrastructure funding that's now available. And so for the last couple of years, we've been working to embed resilience fellows in those communities who can work within local government agencies to actually put in those grant applications. So adding the capacity such that there are more personnel who can actually put in to get funding in their communities. And so this is a program that we've been working to scale in different communities across the US, and we've seen great success for our fellows so far of getting a lot more funding to communities that have traditionally really struggled with getting access to them. And so it's something that I think with all their federal funding available currently, and that they're now community disaster resilience zones that are designated by the federal government across the US that can have further access to federal funding. And so that's specifically where we're trying to put fellows, but would encourage other organizations who are looking for funding to look for opportunities to add personnel in their communities so that, again, more projects for disaster resilience can get funded locally. And then finally here, again, building thriving communities is ultimately really challenging. And I want to harken back to FEMA's National Resilience Guidance that came out a couple weeks ago, that there's something they pose in it as the resilience maturity model. And importantly there, in the way that they're seeking to frame it up, is that, there's different kind of tiers of where communities are going to be in terms of how far along the spectrum they are with resilience planning efforts. So some are going to be more in like an ad hoc stage that, partners are doing what they can in the resilience space. Some, they're going to be more like an emerging phase that they're starting to be more of a local resilience plan. Others are getting more to the point of being advanced in their resilience planning efforts and deployments. And then, furthest along is ultimately having resilience really integrated across so many needs areas and sectors regionally, and being able to be very proactive in any local efforts. And again, there's a lot more kind of things to think about within each of these in this like resilience maturity model that FEMA has posed out. But importantly, and I think as well with the different examples I shared today, is that, a community or a partner that works in this space can be more advanced in kind of one piece of the puzzle and more behind in another. And so, you're not always going to be squarely in one of these maturity phases. You can go back and forth between them. You might be further along with your planning, but further behind in actual implementation of projects and programs. But of course, and I think that's why it's highlighted so high up here in this maturity model that they created, is that you can also take steps back when leadership changes locally and that knowledge base is lost on what has worked. But I would encourage folks to check out, again, this report that FEMA just put out, because there's a lot of additional good guidance and framings for thinking about local resilience efforts. And so with that, again, here's a link to their guidance that just came out. But ultimately, what I really love that they posted up, and so I wanted to include it here, is that building more successfully towards larger resilience within a community means that we all need to know like what our role is within the sphere. And so we're working to have like shared visions of building more resilient people, society, economy, built environment, and natural environment. And so you might focus more in on like one of those key areas, but ultimately to have a more resilient community and country, like we need to be working across all of these pillars and areas. And so we're not going to go over these, but I would just pose to folks to, again, reflect on this within your own work of, for you and in your work, what are the greatest risks and vulnerabilities based on any data analysis that you all have done? What are the impacts that are most important to address locally? And then what are the projects that currently do or could do the best job of lowering risks and serve as good investments for you all? And then finally, what are those additional stakeholders that need to be involved in future planning efforts? And how can we improve communication across different stakeholder groups in order to enact those? So now we're wrapping up here, and we really are so thankful to have had everyone on today. But I wanted to plug again SBP's resource hub, where you can access in particular our different household level preparedness and recovery resources. But there's also information on other upcoming trainings that SBP is providing practitioners or households. I wanted to plug again AARP's Disaster Resilience Toolkit, which has a lot of wonderful tailored guidance for practitioners that work with older adults. And then the New York Academy of Medicine's guidance that had come out last year on strengthening community resilience for preparedness and response. And so I referenced a few of these resources. So for those that work in New York City specifically, Flood Help NY that I mentioned is a great resource to look at different things for the city. But for those that are housed more at large, the New York State Office of Emergency Management has a lot of good resources as well. And so now we're back to Robin's point here, or Alana's point. And so up in 2 weeks from now, we're going to have a follow-up webinar. And so this is aimed directly at the household level and for older adults. And so would really encourage folks to tune in yourselves if you want to learn more about household level actions that we want to encourage folks to take. But it's really intended to be direct to household and help folks in their preparedness journeys. And so we'll cover more starting steps for folks in identifying their risks at the household level, important actions like getting registered on local registries if you have any accessibility concerns in case of evacuation or getting stranded at home. We'll go more into what we mean by recovery planning in advance and things that folks should think about at the household level, starting to make their sheltering and preparedness plan. Talking about tough things like insurance, there's a lot of miscommunication and misconceptions folks have about flood insurance, home insurance, renters insurance. So we'll go more in depth on some of the considerations there for them and ways to make them more affordable. And then we'll also talk about mitigation actions. So quick things folks can do, things that, again, for those that have more limited ability to do things themselves, things that they might want to work with loved ones or neighbors to do to help get their homes better maintained, take some quick actions if you know a disaster event might be coming through, but also some longer term measures to consider investing in at the household level. And so we're really excited to have that webinar in 2 weeks. And so hope that you guys will join us, but also get the word out to more folks.
Okay, well, thank you so much. This was incredibly informative. I want to thank Tessa, Helen, and everyone at SBP. I want to thank Alana Kiefer from the New York Academy of Medicine for working with AARP New York to bring this program to life. And I want to thank all of you for tuning in this afternoon. AARP is a nonprofit, nonpartisan organization with membership for people age 50 and over, offering a wide variety of events, information, and opportunities to empower older adults to choose how they live as they age. We do hope to see you all back here in 2 weeks for disaster preparation at home. Please be sure to invite members of your community to that event on September 24th. You will receive a link to the recording of today's program in an email in the next day or two. So watch for that and share it with anyone you think needs to see it. And that is all for us today. I hope you all enjoy your afternoon, and we'll see you again very soon. Thank you.